On this episode of the Ask Dave Tilley Show, we talk about a bunch of questions specifically, Dave, to Dave for some reason. But we talk about the front rack position in CrossFit athletes. We talk about Spondys and how we judge how well they're progressing. And we talk about ulnar variance in gymnasts and other weight-bearing sports.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We're up at Champion PT and Performance up in Boston, Massachusetts. A little smaller group today.
Dan's international.
Dan's shoulders are out.
Dan Pope is in another country somewhere. The student repertoire, that's definitely not the right word, right? Repertoire?
Squad.
The student squad has dwindled completely. I guess we cut them loose. Let's just say they didn't make it. They didn't do a good job. No, we had a bunch of graduations. We're actually pretty close to the holidays. Not to date the episode, but I think you guys have figured out now that we don't really record these live. Right?
I'd like to point out that I won this mug at last year's Christmas party.
That's right.
Holiday party. Sorry.
That is right.
My hard-earned tokens at Dave & Buster's.
This
got
could
me
be
this
the
mug.
only thing anyone has ever used that they won from Dave & Buster.
Like a pool kit too.
It's a bunch of crap that they have.
I was very proud of this.
So anyway, it's by the holidays, and for some reason Kevin's school has no heart, and they make him do a clinical rotation through the holidays, which is really, really challenging. But anyway,
that's why we took him.
That's right. That's why. Yeah, we're like, that's perfect. We didn't have anyone that week. So Lenny McCreena, Dave Tilley, Mike Scaduto here. Kevin McNamara from Franklin Pierce University in Phoenix, Arizona. Not the one in New Hampshire, but. What's Kevin's nickname? What do we got?
K-Mac?
I call him K-Mac.
K-Mac?
K-Mac's
pretty cool.
It's pretty smooth.
Do you approve?
I approve.
K-Mac
I
approved.
don't like it when they
needs
approve.
something better. Yeah, he needs something better.
Yeah, I'm not a fan.
McNamara's tough,
We
though.
don't have enough dirt on him yet.
I mean,
K-Mac's more dirt on him.
K-Mac's pretty awesome. Let's go with K-Mac,
We
but
have K-Cup, now we have K-Mac.
that's true. Yeah.
Shout out to K-Cup.
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 I see him in the gym all the time.
K-Cup. So K-Mac doing a great job here. What are you? A week? 2 weeks? 2 weeks in and 2 weeks here. He's about to really shine now as the only student
take
here.
off.
What do we got for questions this week, K-Mac? You want to start it up with a good one?
Yeah, so first one here is Pete from Greece. I am a competitive CrossFit athlete and having ulnar nerve issues in both arms for approximately 1 year. Could this be caused by poor mobility in the front rack position?
I'm going to give this one to Dan.
I like this one, yeah. All right, so what's his name again?
Dan?
Pete from Greece.
Pete from
Should we
Greece.
Skype in Dan?
So, hey Dan, we don't know how to answer this question. So Pete from Greece, ulnar nerve issues, bilateral, which is kind of goofy. Not kind of, it's a little goofy.
Not even
but-
CrossFit.
Right, but yeah, that's a good point. But he's in CrossFit, and he brought up the front rack position, which I'm glad he did. Dave, what do you think?
Yeah. So there's definitely two very unique positions in CrossFit that would produce bilateral symptoms. So one is a front rack position, and two is actually a handstand push-up position. So the end position of a handstand push-up is very similar to a front rack. And so
That's a good point.
similar to a lot of issues that I think we see here, we have one area that's maybe moving too much to make up for something else that is stiff. So say, for example, in people who are here in regular fitness, they have shoulder pain because their thoracic spine is stiff. So we see a lot of times that people will have elbow issues just because of the demand of the front rack position is very elevated and then a lot of external rotation at the shoulder, which most people, if you don't develop that from a very young age, it's hard to get it when you're older. So if you take a lot of these smaller issues, like maybe a little bit of thoracic spine stiffness, you pair that with maybe some forearm extension or wrist extension stiffness from forearm flexibility because they grip a lot in CrossFit. A lot of times what happens is you slowly lose motion around the elbow, and then you kind of torque your elbow a little bit more getting into the end of a front rack position or getting into a handstand push-up position. I think that most times it's the mobility limitation is part of it. I think technical issues are huge as well. So people just don't know what a good collar shell feels like in a good open barbell position on front rack. They've maybe not been taught by traditional Olympic weightlifting coaches, so it doesn't sit well. And there's a lot of other factors: fatigue, a little ego, a little too much weight in the bar. Like, I'm not saying that's you, but that's what we see a lot of people here for, is like a compilation of all those factors, kind of just letting them spinning their wheels.
I like that. So he specifically said mobility, and I agree. You're right. It's
Yeah.
probably way more than mobility.
Yeah.
But so to kind of summarize what you just said, then there's potential. Maybe you lost some elbow flexion
Yeah.
right? And you're torquing out
Yeah.
into valgus. Maybe you lost some wrist extension,
Yeah.
right? And then what was the other one? You said T-spine
Thoracic
too?
or
Yeah.
shoulder. I
Right.
mean, the lat
Yeah,
is
yeah,
definitely, I mean, you think about what the lat does. The opposite of the lat is elevation and external rotation. It's very, very commonly stiff in people, especially in CrossFit, which is like lat city.
Right. So break it down maybe. If you're having some like ulnar nerve symptoms and you think it might be the front rack, which should be pretty obvious because you should have symptoms in the front rack
Yeah,
position.
yeah.
Break it down and check each
Yeah.
one. Do you have full elbow flexion? Do you have full wrist extension? Do you have full shoulder external rotation, full elevation? Even though you don't have to be full elevation, I think it just tells you a lot about the status of
Yeah.
the lat, full T-spine, and then break it down. But I agree. I mean,
And the last one too is if you have front rack position doing pressing doesn't hurt. So say when you're above squatting 90 degrees. So maybe sometimes people press from a front rack and it feels fine, but when they do a thruster or a front squat, ankle and hip limitations tip them forward and that causes their elbow problem. So if you don't feel any pain with front rack pressing, try a front squat or a thruster, and if that bothers you, okay, well maybe my problem's in my hips and in my knees, not just in my upper body.
well, that was
Wow.
that was
Just the
that-
last
that-
little
that-
bonus.
Up next level right there.
Bonus right there.
That was-
Happy holidays.
This is the kinetic chain ripple effect that I always talk about. That applies for like 1% of the time, but if it does, if that's you,
I would look at great toe extension.
yeah,
I would look at lateral tilt of your calcaneus.
great toe extension is the perfect one. Everyone used to always say like, man, I remember. They tell the story. I remember I sprained my left big toe, and 2
And
weeks
now I
later,
can't throw the ball.
2 weeks later, my shoulders. Like, yeah, it's all related. I mean, I don't know. There's something more obvious that happened, right? But anyway, all right, good one, nice. I nailed it, right?
Yep.
Are we good? So, all right, what K-Mac, what do we got? What's number 2?
All right, next one is Brian from Ohio. When dealing with an athlete who has spondylolisthesis, what tests or criteria do you use to track progress, especially when the end goal is return to competition?
That's a good
Also, what are your thoughts on belt squats, reverse hypers, and other traction
Blue
type
stone.
exercises for this population?
I like the first half of that question because we all deal with Spondys to an extent, and even stress fractures, and heck, even stress reactions. We may not know that you're dealing with a stress reaction if you don't know how to look at this, but I feel like we do this not just in this sure sounds like a gymnastics
Yeah,
population,
baseball.
in the hyperextension, but also the rotary kind of athlete. So that's a good question. So Dave, how do you monitor? You see the most Spondys here probably. How do you monitor progress? Great question.
Yeah, so I think definitely there's not a good cluster of tests in the literature to gauge sensitivity, right? So gold standard is bone scan or a spiral CT scan, but doctors don't want to expose you to 4 of those because of the radiation.
Especially
so
kids, yeah,
Exactly,
that's a
yeah.
good
So what they want to do is usually they go on symptoms, right? But if you look at similar to how like one slap test or labral test will not diagnose a slap tear all the time, one stork test, which is the gold standard for that, is not always going to be predictive of who's ready to start going back to competition. And so I think it's really tough because sometimes people will still have symptoms, but it's not completely like debilitating, so they don't know when to go. So what I've done just through honestly trial and error and talking with other medical doctors that work in gymnastics is developing like almost like a timeline, a progression of tests. So if you stand up and you do a stork and it hurts a lot, if it also hurts equally as much in a prone press up, right, and then you start pulling gravity more away and it continues to hurt the same amount, you're starting to be like, okay, this is still like really, really flared up. So you do standing back bend or a stork, a prone press up, and then you do a quadruped stork, so elbows, one hand behind the back, and you rotate. It's essentially a stork test, just with half of the gravity eliminated.
Right.
And then you kind of gauge that sensitivity. And then lastly, probably the least provocative is a PA shearing test. So having someone on their stomach, you grab the opposite ASIS and you kind of shear in extension. So if you have someone who's equally as painful in the shearing test as they are in the standing test, I always tell them like, yeah, like you're just at a really, really flared up point. It's probably going to take you longer until the PA shearing and the press up and all those things are clear. You definitely know they're not going to handle super physiological body weight range of demands on a sport. So you'd always be like, okay, once these clear up, then we'll start seeing, do you have symptoms with running? Do you have symptoms with stuff like that? So I guess use that kind of 4-step progression.
And I think I'm trying to follow you. I haven't had enough coffee to completely follow you just yet, but the prone press up quadrant. Did you mention that?
Yeah, so prone on elbows.
You do prone, right, and then a prone
One
press
hand
up
behind the back,
with the
and they
quadrant.
turn and rotate.
I felt like you said that in quadruped. Did you say that?
Oh, sorry, my
prone
fault.
too?
Yeah, prone on elbows.
So which yeah, I was
So
trying to-
standing prone press up,
right.
and prone on elbows rotation, which is an SFMA mobility test, and I use
That's
it for
true, yeah.
diagnostic.
Well, yeah, it's a quadrant test.
Yeah.
I mean, it's pretty common.
But it's
special
not
test,
nearly as much as loaded gravity, so that's why it's usually.
That's a good point.
But
yeah.
usually, if I gauge sensitivity levels when I call the docs around here, and I'm like, man, like because they come to us first without seeing a doctor sometimes.
Yeah,
And
yeah.
I'm like, I mean, I think
Right.
you really need an
Right.
image because like you're still really, really painful.
And it's funny, when you have somebody that has a stress reaction or a stress fracture, or something like that, Spondy type thing, I feel like they know it's a different pain. I've never had it myself.
It's a sharp pinch.
It's
Yeah,
different.
I've had it.
You
In
know?
college,
You
I
had
had
one?
an L5S1 Spondy, and yes, it held me out of my baseball a little.
You wanna talk about it?
So brave.
I was very brave and I fought through it. But it is definitely, it's not a fun pain. I remember lying on the floor in my dorm room or wherever I was living and just like not feeling good about my back. It was
interesting.
definitely a local sharp pain.
You still have the occasional back issue
Exactly.
too, which
So
is kinda interesting.
exactly. So I still every once in a while get a little flare up. Not that, but just you can definitely feel the pain. But I think it definitely holds up not just gymnasts, just the regular population. I think those cluster of tests I've used as well for baseball. You know, a lot of kids that do a ton of off-season swinging or hitting off tees, and I've seen a
2-hour
bunch
lesson.
of kids that end up with like the 1 hour, 2 hour lesson hitting a ton of balls. And they end up with that sharp low back pain that they think is nothing. That 13-year-old, 14-year-old thinks it's nothing, and then you take them through these tests, and then they have an MRI, and next thing you know,
Yeah.
they're shut down for 3 months. And
Yeah.
if you're in Boston, you're wearing a big brace, which we know is not necessarily what everybody's doing around the U.S., but you know it's not a fun rehab process. It's awful for a 14-year-old.
I feel like and the reason why you kind of bring that up too is the sensation of it. I feel like they have a good idea. When you do like a prone press up quadrant based thing, you say, hey, is that
Yeah.
the pain? Is
Yeah.
that familiar? And they're like, yeah.
Yeah.
And you're like, all right, good, you're not doing anything.
Yeah.
So,
You
know?
can definitely tell people have massive apprehension to do that motion. Like when they press up, they're like, you know, you can tell someone's like
Yeah.
super acute.
Yeah. All right, we're gonna skip the second half. Let's go to the third question because that was it. I liked your first question. I mean, the first half. Second half was good too, but let's go one more. Let's go third
All right,
question.
next question is Andrew from Colorado. Hey guys, I'm a DPT student in Austin, Texas. I love all things baseball and shoulder and love the podcast. But surprisingly, I have a question more specifically for Dave.
What's going on right now?
I told you, I don't know what happened on November 21st.
I think it was Worlds. I think Worlds.
November 21st, 2018, we got 30 questions all for Dave. I'm not kidding, in one day. I'm not kidding, in one
My
day.
mom. It's my mom. My mom's typing a mullen.
All right, what do we got? Sorry.
I'm learning about ulnar variance and was told that young gymnasts may have issues with this. I was wondering how prevalent this is and how Dave would go about treating this with his gymnast athletes.
Mike?
Let's see.
Okay.
Ulnar variance.
Ulnar variance is definitely a very unique thing to weight-bearing sports, so not just gymnastics, but people who put any pressure on their hands a lot. So long story short is that you have obviously ulna and radius, right? So in weight-bearing sports, 80+% of the weight bearing is through the radius, so it's on the outside joint. So when you are putting a lot of load on a wrist that is not designed to take weight bearing, all of the pressure being on the radius side, unfortunately causes like it to stop growing. It causes the growth plate to squish. So the ulna
the radius.
the radius continues to get squished. The ulna then grows normally. So you have what's called ulnar variance when the ulna starts to go ahead of the radius versus normally it's kind of the other way.
Whoa.
Yeah. So what happens is they have ulnar variance is positive when the ulna grows past the radius, and the reason that's an issue is because it can cause issues with ligaments on the outside of the wrist, but then also you have a massive amount of pain on the inside of the wrist here. So it's a problem for gymnasts because now you have the biomechanics of like the TFCC joint is thrown off and the amount of
Right.
load on the wrist. Gymnast wrist is like the patellofemoral syndrome of gymnastics. It's like the worst term ever. And it doesn't help you specify anything, but everyone says like, oh, I have gymnast wrist, which is just a growth plate fracture. So if you have ulnar variance, sometimes they will make you go in and get a surgery where they cut down your ulna and do a rest. So they put an ulnar physis arrest, which restores the biomechanics of the wrist to not put pressure on the TFCC. So treatment-wise, no, not really anything you're gonna do, but it's a bony adaptation because they've done too much on their wrist, not enough physical prep before they did a lot of loading on their wrists, and it causes, I mean, some gymnasts are like career enders if it continues to be an issue.
How common is this?
It's very common.
I may be wrong. I try to listen to all your conversations
Yeah.
in a weird kind of way,
That's
and
weird.
I've never heard of you talk of this.
So it's never something that you describe to somebody in depth because of the biomechanics and the
Yeah.
anatomy. They just have wrist pain.
Okay.
Is
Yeah,
it something
so-
you can like detect just by
You
looking
can't
at
you,
the
you can't detect. It's on an X-ray. They like
Yeah,
hold it
just
up like this.
It's not like super
And they
obvious.
measure the angle between the two. I would say it's probably super common. It's like starting to happen when people have really bad growth plate fractures. They usually fracture their radius before they get so much pain. But when they get through puberty and they're 14 plus, they've had a growth plate fracture, and then they keep training.
Yeah.
The growth plate doesn't. It's kind of like the same thing as like you wouldn't describe like the anterior band biomechanics of a UCL, but you know it's an issue
Yeah,
that
yeah,
they're
yeah.
dealing
Gotcha.
with.
Okay.
Yeah.
Yeah.
Wow. Good stuff. So,
Yeah.
unfortunately, so that's what it
John
is.
DeFore is the lead researcher in that. If you want to look it up.
Look it up. Awesome. Well, great episode. If you
Yeah.
guys have any more questions for Dave,
Glad we could contribute.
Seriously, that was a baseball episode.
head to
We should
MikeReinold.com.
just sit here and drink my coffee for baseball episodes.
Click on that podcast link and ask us questions. We're here too. If anybody has any questions that are related
8
to
golf
us.
questions coming up next.
So we're good. but yes, please head to the website, ask us some more questions. Go to iTunes and rate and review and subscribe and all that stuff. And we'll see you guys on the next episode. Thanks so much.